As the COVID-19 pandemic is raging around the world, everyone has to wear masks to prevent the spread of coronavirus. However, some people decide to wear a closed mask or even not to wear masks. One may be wondering, does a face mask really prevent the transmission of airborne pathogens? According to the research from University of Central Florida in 2022, face masks reduce the distant airborne pathogens which travel from direct exposure when speaking or coughing by more than half compared to not wearing a mask. As COVID-19 rapidly spreads across the world, especially older adults, care providers, and people with underlying health conditions, it degrades the mental health of the public, causing issues like stress, anxiety, and depression. Therefore, an effective face mask for our everyday use is very important. The three most common masks that can be found currently are medical masks or surgical masks, N95 or KN95 face masks, and reusable cloth masks. They all act as trapping air droplets, avoiding contacting space with germs and filtering out air particles. For our expectation, N95 masks have the highest level of protection among all, while medical masks are more effective than cloth masks. But is this really the case that these masks are rated in this order, or this is no substitute for us? Let's find out with an experiment.
In this experiment, a medical face mask or surgery face mask, an N95 face mask, a piece of tissue paper, a piece of paper towel, and a towel are prepared to test their ability to avoid air leakage. First, light a candle in a safe place without wind. Next, we try to blow away the candlelight with the chosen material covering our mouths. Then, observe whether the candlelight flickers or even be blown out. Last, repeat these steps 3 times for each material, testing for more accurate results and then recording them. After 3 trials of experiments, the N95 face mask expectedly had the highest ability in protecting the candle flame from exhalation. However, a surprising fact is that paper towels were as powerful as N95 masks under this test. Both of them could hold the fire still without any flicker for all 3 attempts. The second best result is from medical masks, which could not keep the candlelight steady in most trials. One of the trials even had obvious movement of the fire, and for cloth and tissue paper, none of the trials using them could prevent the flame from the effect of blowing. 2 out of each of their 3 trials had clear flickering as a result.
We can interpret from the experiment results that the N95 mask may be the most effective prevention of the airborne transmission of pathogens. Medical mask may be the next best type of mask. The cloth mask, in which we use cloth for representation in the test, was the least efficient barrier, leaving the wearer most vulnerable to airborne pathogens. In an attempt to find valid alternatives to the face mask in the event of an emergency, a paper towel may be a better choice than tissue paper to prevent the spread of disease. From the survey conducted to evaluate the public perception of the efficacy of the face mask in preventing COVID-19, we found that out of 90 participants, 85.6% believe masks are effective in preventing the spread of COVID-19. Surgical masks were the most popular choice of the mask within the participant group, with 78% using surgical face mask while 19% used N95 face mask most often. Most participants believe that N95 is the most effective mask against the spread of COVID-19, while most participants were under the impression that cloth masks are not as effective. Most people from the sample of participants believed that there was no substitute for a mask, while only 19% thought a towel would be an adequate substitute and 33% chose tissue paper. We can conclude that the public perception of the mask efficiency matches the experiment's result. However, the population still needs to be aware of the alternatives for the face mask in an event of emergency.
Our experiment aimed to determine the effectiveness of different face masks in preventing airborne pathogens. In this experiment, we mainly used a burning candle to stimulate the amount of air transmitted when someone blows behind different material. As we expressed, the test results show that N95 has the most incredible prevention efficiency. However, we are not sure whether the high air tightness is the primary factor in identifying whether the chosen material are effective in bacterial protection, because we are not able to detect the pathogen-fighting ability of Zain in this experiment. For us, the public, this standard can be used to select masks that are more conducive to protecting against airborne pathogens.
So, N95 or KF94 face masks are the best choice for us to keep healthy in the COVID-19 pandemic.